Mental health crisis. If you're having a mental health crisis and the physician here in Texas or someone declares you incapable of making your own decisions with regards to your mental health, that could lead to some interventions that maybe you really did not want to be done. So the Texas Department of Health Science website or Health Services website has a form, and this is a new advanced care planning tool called a Declaration of Mental Health Treatment. And on that form, you can state very, very clearly what you would prefer, what treatments are restricted and which treatments can do. The most important part of this video is, as a follow-up to my advanced care planning videos, is what I recommend to my patients now that this form is out there. I think it's actually a really good form now that I've had time to process it. So you'll see a section on there about convulsive therapy. So that's the shocking that dramatically in Hollywood that they put the device on the person's head and they shock them and they're like shaking, which doesn't happen, by the way. It's actually very short. It's actually an unremarkable event, but in Hollywood they make it look like you're having a seizure when you're getting elective convulsive therapy. But you can say no to that, so that way it's not an option. The other thing I recommend to my patients is no Haldol. We do not use Haldol. Haldol is bad. And so if you can restrict the use of Haldol on you in that moment, if you're having a mental health crisis, that you're not making good decisions, because Haldol shrinks brains and we really shouldn't be using it anymore. I don't like it. I don't think as soon as I saw that data, I would never use that if I was an inpatient. I haven't been an inpatient doc in a long time, but I would not recommend using it. I don't want it used on me. So I hope that helps. Think about putting that restriction or seeking advice before you put that restriction, and to have those documents, make sure you send it to your primary care. Tubby Doc out.